The media have gone out of their way to play cheerleader for Obama's healthcare plan by attacking opponents who are actually making provably true statements about what is in the law. MSNBC's Rachel Maddow is especially egregious and inaccurate in her bombast.
But honestly, it's not that Americans in general widely believe these off-the-kook-end theories. It really is specifically Republicans who believe this stuff. And nobody else does. There is a huge gap between what Republicans think is true, between what Republicans think are the facts at issue here, and what the rest of the country thinks. The latest NBC News Wall Street Journal poll asked respondents whether they believed 4 big myths about health care reform. And then they asked those same respondents what their usual source of news is.
This is the only true statement she makes in this diatribe.
The poll found that the gap between Fox viewers and MSNBC and CNN viewers who wrongly believe health care reform will give coverage to illegal immigrants, it's a 31-point gap.
Although the law doesn't allow health care to be provided for illegal aliens, it does eliminate the 5-year waiting period previously required of legal immigrants to receive entitlements. It will let legal immigrants not eligible for Medicaid to be covered immediately and at the maximum level of subsidy allowed. Of course, if the president pushes through his immigration amnesty bill, this is exactly what will result.
The gap between Fox viewers and MSNBC and CNN viewers who wrongly believe reform will lead to a government takeover of health care, that gap is 40 points.
We'll address that bit of provable fiction when combining it with another of her 4 alleged myths of this healthcare bill in a moment. But now, we give you another evidentiary falsehood regarding how this law deals with abortions.
The gap between Fox viewers and MSNBC and CNN viewers who wrongly believe that healthcare reform assures taxpayer-funded abortions, it's a 29-point gap.
Rachel concludes her self-discrediting diatribe with another insultingly false and partisan accusation.
The gap between Fox viewers and MSNBC and CNN viewers who wrongly believe that the government will decide when to stop providing medical care to the elderly, it's a 45-point gap.
Ms. Maddow, please refer to page 1176 of the law and look at lines 2 through 11 and tell us how to interpret age-appropriate preventive services. Now look at page 1179, first at lines 3 through 10. And then at lines 15 through 19. Ms. Maddow, please indulge us by continuing to page 1180 and read lines 4 through 11. Have you noticed the consistent theme when Rachel pummels Republicans for having a different set of facts than the rest of the country? She is comparing the law's opponents with what is believed by viewers of CNN and MSNBC, treating their opinion as valid evidence of her position. Considering that those viewers are fed by the likes of Rachel and Keith Olbermann, of course they will reply to poll questions as they have. Rachel is treating their agenda-fed receipt of information as fact and then uses it as evidence to prove her point. Intellectual integrity at MSNBC is at a new low.
In other words, we're trying to have a debate in this country between two groups of people who have two totally different sets of facts. We like to think of the political universe as all one thing, as a place where, sure, everybody has different opinions, but we all at least agree what it is that we're fighting about. It's just not true. Americans who are members of the Republican Party, who identify as Republicans, they have a different set of facts from the rest of the country. Their understanding of what we're fighting about when it comes to health care is not only different than the rest of the country, it's wrong. They believe things that are not true about what's being proposed for health care reform. They exist in their own fact-impaired mini-verse inside what we thought was a universe.
Let's do a review. We just showed language in the law that includes the following. Abortions can be covered, legal immigrants have their waiting period to receive entitlements waived, and the government determines the frequency you are allowed to receive preventive exams. The Secretary of Health and Human Services must approve your preventive care, but only after you pass a government panel-run risk assessment. Among the conditions governing an approval are based on the services being age appropriate. So much for the defenders who deny that this law ushers in government-controlled health care. Okay, Rachel, we have eviscerated each of your fact-devoid rantings as empty noise driven by partisan hand-wringing. There can only be three reasons for this. 1, you can't read. 2, you didn't read the law and leapt off the cliff in blind loyalty to Obama and the left. 3, you read the law and knew you were spewing intractable lies in a pathetic Faustian gesture. TV folks have teleprompters, so 1 is out. The choice is between 2 and 3. I picked 2 because ignorance is more defensible than duplicity. Miss Maddow and any other media member who hysterically attacks anyone for making provable claims about the law are committing 2 acts. They are being disingenuous shills for the administration, and they are being intellectually dishonest. This information is publicly available, yet they post their stories or scream into the camera to tar anyone who opposes this law as liars, kooks, or racist. They do this without a shred of evidence. They are under the egotistical illusion that their words are inherently valid on their own merit because of who they are.